Still talking about the uses or applications of electrocardiography. One of the uses is you can use it to access for chamber enlargement. So you are using it to check if the right ventricle is enlarged, left ventricle is enlarged, right atrium is enlarged, left atrium is enlarged. Okay, you can use the ECG to confirm that, right? So let's quickly look at that. We'll be looking at the characteristics of ECG if this particular chamber is enlarged or this particular chamber is enlarged. Okay, so we said that what atrial hypertrophy or enlargement, you can use the ECG to confirm this, right? So consider using the leads the leads 2 and V1. All right. So normal P waves. Okay. Normal P waves, that is okay. They will be less than 0.12 seconds in duration, and their amplitude will be less than what 2.5 millimeter in amplitude. Okay. So in right atrial enlargement, okay, like here now is like how the normal P wave should be like, right? But when you are having tall P waves that are greater than 2.5 millimeter in amplitude, they were having what the duration being more than 0.12 seconds. It suggests that there's a right atrial enlargement. Okay, then if for left atrial enlargement, if you're having a broad P wave, which is more than what 0.12 seconds in duration, all right, then okay, sorry, this right atrial enlargement, it was less than 0.12 seconds. Sorry, this is going like this. Is the amplitude that is more than, okay, but the duration is less than. Okay, so this one now, you are having a duration that is more than 0.12 seconds, all right, and an amplitude that is less than 2.5 millimeter, and that suggests what P mitrale. All right, so that suggests P mitrale. All right, so that's chamber enlargement. Then that was for atrial, left atrial, right atrial. So moving to the ventricles now. So for the right ventricle, the ECG criteria for right ventricular hypertrophy include there'll be right axis deviation. The R in V1 will be more than what 7 millimeters. All right. Then if you divide the R, okay, like the R wave, S wave in V1, it will be more than 1, which is usually supposed to be less. Okay. Then you also have what P pulmonale, and P pulmonale is usually what the P waves are more than 2.5, but the amplitude is less than what the duration is less than what 0.12, okay, seconds. Then for left ventricular hypertrophy now, all right, you can use the Sokolow-Lyon index criterion, where SV1 or R, okay, that's S in V1, R in V5. That's if you add them, it should be more than what 35 millimeters, or you use only what R in V6. So you see that R in V6 is more than what 35 millimeters, right? They use there's also the Atrial criteria, where if you are adding the S in V2 and the R in V6, it should be more than what 40 millimeters in men. Then if you add the S in V2 or R in V6, it should be more than 35 millimeters in women. Okay, usually supposed to be less, right? So R in lead 1 is more than what 12 millimeters, right? So strain pattern 2, if you are seeing an inverted T wave in V5 or V6, indicates that there's what left ventricular hypertrophy. Then the last criteria for dictating left ventricular hypertrophy is the what Cornell criteria, where if you are adding the S in V3 and the R in AVL, it is giving you more than what 28 millimeters in male. Or if you are adding the S in V3 or R in AVL, it is more than what, 20 millimeters in females, right? So I think these are possible ways in which you can use the ECG to what, access for heart chamber enlargement, right?